I'm Dr. Virgie Bright Ellington. And to find out what your social work doctor wants you to know, I reached out to Dr. Raheem Lay. Raheem Lay, Doctor of Social Work and licensed clinical social worker, is a 13-year United States Air Force veteran who earned his master's in social work from the University of Tennessee and his Doctor of Social Work from the University of Southern California. Dr. Lay has more than 20 years of experience in mental health therapy, 18 of which were leading several mental health therapy initiatives during his time in the United States Air Force. Dr. Lay is also certified in empathy and emotional intelligence coaching and has founded 2 educational courses to help men and women master their emotions and build thriving futures. What's especially insightful is one of the courses is specifically designed for new police officers, and the other is for students, teachers, and other civilian professionals. Having witnessed empathy coaching transform the destiny of countless individuals, Dr. Lay is thrilled to share his expertise with his first book coming out October 2022, called Men with Empathy, MEN with Empathy, Managing Emotions Naturally with Empathy, which is a self-help guide that teaches boys and men how to use emotional intelligence and empathy to grow into respectful, inclusive, and compassionate leaders. Good stuff, Dr. Lay.
Thank you.
Thank you so much for your service.
Oh, thank you. You're very welcome.
And your ongoing service. You're still active military.
I'm still active duty. Yep. Still serving.
Gosh. Thank you so much for all you do.
I appreciate it.
And again, thank you for joining us. I know that you're active military, you're seeing patients. So I know you had to carve out some serious time, and let's just get right to it because I know you have a patient waiting to talk to you. So,
yes, ma'am.
I wanted to ask you to, if you can you tell us about your journey to your time in the military, to getting a doctorate in social work, and essentially, Dr. Lay, leading the way in teaching emotional intelligence to active military, veterans, and now civilians.
And again, thank you so much for having me on. I've been in the Air Force for now 13 years. I was prior service in the military. I was an infantryman, but I pursued my education prior to military by getting my bachelor's in social work, my master's in social work, and of course, eventually my doctorate in social work. My reason for doing so was because one of the first influential professionals that I had in my life at a very young age, around 5-6 years old, was a social worker. Of course, the only social workers I knew at that time was Department of Children's Services, things of that nature. So going into college, when it was time to pick a degree and a focus, I said, man, you know what? They were the only ones that were really kind of stood out to me. I was always intuitive. I was very good listener, very talkative. Maybe that was good or bad. I don't know. And even when I finished my bachelor's in social work, I still didn't know what I wanted to do. So I did join the Army, active duty as an infantryman. But even when talking with other guys, being around the guys and just growing and learning, we're becoming trained individuals. We're learning discipline at the same time, structure. And I realized I got a high off of that. I really loved it. I loved the camaraderie. I loved understanding men because I was raised by a lot of women in my life who were very, very influential, impactful. But I do have an older brother. And so just being in that atmosphere, I was an athlete as well. I went to school on a track scholarship to Ole Miss. And so I was always in some form of an institution. I was always around people. I became a people person. I started to understand behavior, and it started to really have a profound impact in my life. And so when I got out of the military, the Army, I went and got my master's in social work, still not really knowing, what I was going to do, but I knew it was going to involve people, building programs, being around people, impacting others, because I really thrived off of that. And I love the leadership that came along with it. And so,
Dr. Lay, before you go on talking about your journey and deciding to go to graduate school during your time in the military, before you even got to college and you're in high school as a junior high school kid, when you say that you were thinking about making your plans to go to college, were you thinking about becoming a social worker at that time?
No. I was thinking, I grew up in Newark, New Jersey, and there was the growing idea that going to college as an athlete, getting yourself out of a bad situation, survival of the fittest kind of attitude. So I was really going with the flow. Track and field really did open me up to see things differently. I saw other nations, I saw other cultures. And so I still had this knack to just get up and go and talk to people, to listen to people. So no, social work, I did not know. It wasn't into that pressure of college, like, hey, you got to pick a major. If you're a student athlete, you got to pick a major. We got to get you tutors and all of that good stuff. This is a Division I school, so they didn't play,
Okay.
They wanted you focused. So that's when I looked at all of the different degrees and ideas and all of those kind of things. And I did look at the amount of time I would have to spend in my sport. I was looking at, okay, how can I manage this successfully? Because I really had no guidance in that. And again, the social work thing popped in my mind as I went through the social sciences. Your first 2 years, you kind of just get in core classes. But when I started to look at where do I fit? Where does my personality fit? And I can be more of myself. Social work just really fell, and psychology, they both fell in that lap. And it was just by the luck of the draw, I ended up in social work.
And then what made you decide to enlist in the military when you're finishing your undergraduate work? Did you know you wanted to go to grad school? Did you know, look, I want to get my master's in social work? What were your thoughts? You did both the military and graduate school. Can you tell us about your decisions for both?
So I graduated in 2000. So this is before 9/11, of course. And when I joined the Army, going to boot camp, I did have this thought in the back of my mind. I think every military member that's gone enlisted, that's gone to boot camp, may have had the same thing. Like, what did I just do to my life? I was used to institutions. I was used to discipline. Again, I was a collegiate athlete, so I did find the individuals. We would get up. Matter of fact, let me go back. We will be in college. We'll get up. We have to go run, do the stadium stairs or something like that. As an athlete.
Yes.
And on the street in the university, I would see Air Force paraphernalia, Army paraphernalia, and I didn't know anything about ROTC. And then the pole vault jumper for our team, he was Air Force ROTC. He would come in there, and I just liked his style, actually. He very disciplined, didn't really say much, but he was a winner. He was just very disciplined. And that sparked my interest. And when I was finishing up my bachelor's, I still was like, well, what am I going to do with this? What can I do? I didn't know how to apply what it is I learned, which is a lesson I definitely want to touch on a little later, but I didn't know how to apply it. There was some cold feet of getting out there, getting a job and doing all of those things. And one of the things, I just so happened to be talking to this one individual who was the Air Force ROTC grad. He said, man, with your discipline, your structure, you should definitely think about the military. And it's like, well, I'm a senior, so it's too late, to go ROTC. He was like, no, you can go join the National Guard or whatever have you. And I was like, really? And so I went to the recruiter and I said, hey, I want to be infantry. I want the best of the best, if you will. And it kind of jumped from there. And after 4 years of doing that, I got out and then went and got my master's in social work. And that was really because I wanted to do more in my field. I did start to familiarize myself with individuals. When I was deployed, we had social workers, mental health providers who were downrange. Downrange just means you are deployed in an area of operation. So it would be Iraq, it would be Afghanistan.
Like in the mix, like on the front lines, for real.
Front line. Oh yeah.
Okay.
Oh
okay,
yeah.
Gotcha. Okay,
And,
that's a big deal.
And so what was interesting is we did 9/11 jumps off, of course, and all of this is happening. And we did go through some pretty bad stuff initially. And long story short, we had to go see what they call combat stress. So it's these mental health providers who are there utilizing certain techniques to just talk to individuals who've just undergone or seen some things that were probably impactful to the individual. And one of the guys that I spoke with, he was a major. I spoke with him, and as he was talking, he was using vocabulary that I heard before with school and things of that nature. And when he told me what he did, and I said, wait a minute, you're a social worker? And he was like, yeah. I was like, I have my bachelor's in social work. And he said, well, what are you doing in the military as enlisted? And I was like, what do you mean? And he said, man, you should go back and get your master's and then look at becoming a licensed clinical social worker. So he really was the one that put the bug in my ear. And I was like, oh my God, I didn't know that existed, let alone in the military at that time. And so that was my plan. Once my 4 years ended, first contract, I got out and got my master's in social work. at the University of Tennessee.
When you finished your master's, what was your plan, Dr. Lay, at that time?
Yeah. Yeah,
What
you're
was
going to
the
get a kick
plan?
out of this one. So the plan was to do what this major did, which was get in the military as a mental health provider and, become a mental health provider in the military because I can still be a part of the military. And mind you, too, when I went to basic training boot camp, I'll never forget my very first day. Back then, the Army, when you get to Fort Benning, it was a PT test, a physical fitness test, your first day after that night, not 0 day, but your first day, you have to do a PT test. Right now, I'm coming off of the SEC, competitive world. So I'm in tip top shape, basically. And we get there and I've never ran a 2-mile race before. And so what drove me with the Army and how I became obsessed with it was we have this thing in track and field where when you are testing someone else's work ethic on the track, you pretty much sit on their outside shoulder, sit behind them, and then you run off of them, basically. You let them take the win, and then you out-kick them, basically. And I did that in a 2-mile race because I never ran a 2-mile like that before.
So you were a sprinter and a jumper, pole vaulter?
No, I was a 400-meter runner. So mid-sprint, mid-sprint, 400, 800-meter runner.
2-mile definitely was not your background.
Oh, no, that's not my thing. No. I have a lot of respect for those guys, but I did it. And what happened was I did not know the guy that I was pacing off of was a drill sergeant. They put him in PTs, so I thought he was one of us. Well, I ended up beating him. I ran like 10:21, which I didn't even think that was fast at that time. Okay, I didn't think that was fast. But what happened at that time was the drill sergeant pretty much rolled me the whole entire time of boot camp. They saw something.
What do you mean he rolled you? What does that mean? He rode you, RODE, or rolled like roll?
Yeah, that's a good point. So we say road, meaning RODE, meaning he pretty much hassled me the entire time because I beat a drill sergeant, which was a no-go. You don't beat a drill sergeant. I had no idea. I'm a competitor, so yeah, I was.
You were just doing you.
I was doing me, and so I would be the last. It was like last to eat in the line. I would do overhead arm claps and do a bunch of push-ups. But the next day, we have to go to the parade field. Okay, and he made me march my whole platoon. And what he realized, the next week, not the next day, the next week, he made me the PG. He made me march. PG is the platoon guard. He had to pretty much, you lead your platoon. And so he made me march my platoon, 64 men. We had to march to the parade field. The parade field was probably maybe a mile down the road, but marching, it felt like forever. But I memorized every single cadence that my drill sergeants used to, what
the first time going
the
through
first time out there.
No way.
I kid you not. And when we got to the parade field, he looked at me. I was sweaty. It's Georgia, so it is what it is. But I was all sweaty and everything. And I don't even know where it came from, to be honest. And he looked at me, he said, "You memorized every cadence, and he said, "I'm gonna keep you as PG." And I kid you not, the confidence I had was ridiculous. Like, I actually didn't want to leave boot camp. I'll be perfectly honest with you. It was like hard, yes, but I honestly didn't want to leave it. So fast forward, even when I got my master's, I was still missing that environment, that culture, the military culture. I was not ready to go into the civilian world. So what do? I jump right back into the Army and we deploy immediately back to Iraq. Yeah. I went to combat stress there to see individuals, to talk and, see the providers there, let them know I had my master's and all of that good stuff. But I got put on stop loss. And what does that
mean, stop loss?
I don't think they do it anymore, but stop loss was basically the military holds you from getting out, basically. And so even when I got back from that deployment, I could have gotten out and, tried to go to officer route and all that good stuff. So I put in an officer packet and then I got put on stop loss. My officer packet wasn't accepted as far as switching over to the Air Force. At that time I was trying to switch over to Army officer to become a mental health provider. The Army mental health providing team, providers, you had to be fully licensed. Like your husband, the CSW, which I did not have because I had no clinical hours. Right. Okay. So I couldn't even do it anyway. So I just stayed in the military until 2009 and I got my opportunity because they had a residency. Air Force had a residency program and I jumped over, did the direct commission. The Army did let me go. My colonel, he was like, "What? Where are you going?" And I told him what I wanted to do. but he gave me the greatest message. He said, even though you won't be in infantry or anything like that, you'll still be an asset to the military as a whole. And that really did put my mind at ease about, jumping over to a different branch and going into a different field, becoming an officer, which is big difference between officer and enlisted, if you will. So that really spearheaded me into getting into this clinical realm and really seeing the potential and the growth that comes along with it. So I had to buckle down, and because my mind was military, it was not therapy. But the more interaction I had with people, the more I started seeing people that I understood, because I came from the enlisted ranks, I came from deployed environments, I came from the military life. It did make it easier for me to connect with individuals. Throughout my journey over the past 13 years, I've seen where I've lacked empathy and emotional intelligence, how that has hurt my not only military career, but how I've seen other individuals, patients that come into my office who definitely had the same issues, and so I said, man, I have to do something, so I really started applying myself in different avenues outside of therapy, just taking initiative, and doing things outside of military day to day. And I just started bettering myself with outside knowledge. And like I said, getting certified as an empathy instructor and life coach with emotional intelligence, like these things were very impactful to me. And I said, I gotta get this information out. And that's when I started writing.
So you started writing before you decided to get your doctorate in social work.
Oh, yeah. I started looking at empathy back 2016, where I saw how empathy kind of gave a foundation to human interaction. I'm a huge advocate when it comes to empathy with men, but also at the height of 2018, 2019, you started to see a lot of the police brutality, things of that nature. I started getting into social media, understanding it and listening to content. And one of the things that just kept popping up that I think people were not paying close attention to was the ability or the power of empathy. And I applaud women because I felt there was this natural, or I guess you would say, that came across when I would speak to women about empathy. They can definitely go there much quicker. And it was natural the way it just rolled off of conversations. It wasn't uncomfortable, if you will. And so I knew that this was a space that I had to get in. So that was really, really important. So yeah, before I started writing, before I got into my doctorate program, I was writing here and there, just putting bits and pieces together, talking to, coming into safe spaces and talking about empathy, how it applied to kids, and then of course looking at police officers and seeing where the disconnect was. And so it just started blossoming from there.
Then what was the impetus? What made you say, you know what, I'm going to get my doctorate in social work? I'm going to become a social work doctor. How did that happen? You're active military, you are providing mental health therapy services and developing initiatives for active military.
Right.
And you're looking at what's happening in the civilian world with, the way young males are socialized in our culture, and the issues with police officers, lack of training and consistency in training and working with the public. What made you say, you know what, this is my next path. This is where I'm going. I'm going to become a doctor of social work.
And you're absolutely right too. That question there, for any social worker to try to achieve or try to attain the highest level of education in that specific field, right? We get our license at master's level. So technically we don't need a doctorate, right, to do therapy, right? But there was this need for more regulation, more application. I got a hint of design thinking, building, creating. And I've always thought, when it comes to social work psychologists, I always thought one studies why something is the way it is, and the other studies how do we create to resolve that issue. And I like the idea of creating. And so when I looked at the different doctoral programs, USC stood out to me because their whole model was around design thinking and innovation. You're dealing with creativity, you're dealing with the arts, you're dealing with people who are not bound by institutions per se, but they want to attack wicked problems, and the more I started to dive into what was happening with police, and they were trying to separate us, turning us against police officers, or, the media can do a lot of different things. I'm one of those that's always looking on the outside in, basically. If I see the media going one way, I try to think, okay, why is it going that way?
Mhm.
I have a huge respect for police officers, but I said, man, when it comes to military members, especially with my background, it was sort of along the same lines, if you will. Not quite, but the rule of thumb of protecting your fellow men, how you're asked to get out there wearing a weapon, and you're going out in a community or an environment that you're not familiar with. You have limited association with oftentimes, and you're asked to perform or do missions that may, can definitely be, according to anyone, can definitely be very difficult to do. And I did not like the way the world was going. I didn't like the divide that was happening, but I found myself getting angry. And one of the things about emotions, especially what we teach in therapy too, is, you're supposed to respect your emotions. You're not supposed to give them power. And
Can you repeat that, Dr. Lay? Say that again.
The emotional management is all about respecting your emotions, not giving them power, especially when they're negative, right? When you feel that buildup and things of that, like acting on your emotions, knowing there's a second and third order effect or consequences to that. And I am totally guilty of it, first and foremost. I have done it. It has gotten me in places that I didn't want to be. But this is one of the things I do stress to people that, in the midst of this, the title of this interview, as far as what we want our, clients or people to know. One of the things I learned is that things happen for me and not to me. But I used to speak like things are happening to me.
Yes.
So it was sort of a victim mentality, to be honest. But when I started to, educate myself about empathy, about emotional intelligence, and about managing my emotions, which I did learn a lot of that in my military background too, but I wasn't applying it, so I wasn't getting the results that I felt like I deserved. I was getting the opposite. And so I started to think about that, like, hey, you know what? I cannot give my feelings any more power. I got to learn to just respect them. Respect them just means processing them. I have to process my feelings. I have to put myself in a space where I can communicate, whether it's to my friend, to my wife, to whoever, about my emotions and understanding them, or journaling, which I still do, by the way. I have 2 journal books, one at work and one at home. So I do it. I am one of those. But it teaches me to respect my feelings, to understand where they derive from, why they're connected to my emotional box, which we all have. Okay. And how do I take accountability for my reaction to whatever situations happen, external situations happen. And once I started to do that and started to apply that, I was like, wow, I can put all of this into a learning tool. And I want to focus on men because it was something that Jordan Peterson, he was the one that kind of, as you asked, what made me go get my doctorate. I was listening to Jordan Peterson on a podcast, I believe, just listening to some of the things he was saying about competency, about men taking accountability, about men being at the forefront of their own responsibilities, and just that resonated to me that, there are things that I thought about, but I was fearful of because I didn't want to perform at that level. I kind of wanted to hide out, if you will.
Can you tell us what you mean? You were fearful of what? And what?
The performing.
Fear,
yeah.
Performance anxiety, fear of success.
Fear
of
success.
Failure.
Yeah, it's the fear of success. I've had a lot of failures. Wasn't fearful of that because pretty much everybody in my reference group, in my circle, was failing at something. So I wasn't scared of that, actually. Like I said, I grew up in North New Jersey. It was when you see certain things, you know how to conform to failure. At least I've gathered that. But fear of success. And the one thing about success is if you have it, people are going to expect it now. And then you'll have to maintain it. That's a whole different level of discipline that I did not either want to have or I felt that I wasn't deserving of. I'll tell you a story. When I was in college, I went to University of Mississippi, Ole Miss, from Newark, New Jersey, down to Mississippi. And
culture shock.
It was such a culture shock, but I'll tell you what, the one thing that caught me, and I still to this day, I share this with young guys too, is that my walk was totally different in that I walked as though I was happy to be in college, that I was happy to be there, compared to some of the individuals, my peers, who walked as though they were supposed to be there.
Wow.
And it was a big difference.
Wow.
I'm talking about in the way they reacted, in the way that they answered questions in class, the way they freaking carried their books. I know that sounds crazy, but it was. I saw it,
Yes.
It was my, and I said, dang, I got it all wrong. This should be a space for me. Why not? And once I started to say that, why not? Then I started to apply myself and put myself in spaces that I knew I was not an expert in, but I was there to learn. And so that's where the motivation to get my doctorate. So Jordan Peterson connected with, I can't be fearful of being successful. All of those things kind of came together.
It's interesting. You talk about the fear of success.
Yeah.
And you're okay with failure. And you said, failure, essentially, I'm paraphrasing, but what it sounds like you're saying is that failure is just lessons. It's just life lessons. It's just part of life and learning. So the great Nelson Mandela has been known to say, he says, you know what? I never lose. I either win or I learn something.
That's an interesting, I and I would take it a step further, and this is going to sound really weird, and maybe other people can relate, but when you fail, the reason I wasn't afraid of that, for some reason, this is just what I've noticed, for some reason, you have more support when you fail.
Wow.
When you're successful, you do not. And that's what I was afraid of. My support system knew how to deal with failure. They can say things, they can excuse your immaturity, they can make excuses for your lack of trying. And I've been in those situations. I've done it, and people have done it to me, and I was okay with it. So that's what I meant really when I say I wasn't afraid of failure, because I knew somebody was going to be there like, yo, it's okay. You know what? Don't even worry about it. Ain't nothing. Look at what you've done so far, kind of thing. When you're successful, though, big difference. Everything is better. And there's where it becomes very scary, because you're on that mountain by yourself.
Well, they say it's lonely at the top, right?
Oh, my goodness. Yeah. When you know better, you do better, kind of thing. And so when you make mistakes or whatever have you, or when you don't live up to what you put out there, it's almost like, wow, you're a hypocrite. You're this kind of thing. And I was afraid of that, because I didn't know what was genuinely driving me versus what was, as a male perspective, ego and things of that nature. Where did that play in? But did my ego play into getting a doctorate, or did I really want to do something with this doctorate? Is it just having the doctor so-and-so in the name, or did you really want to learn the highest level of education so you can apply it and lift others? Like, what exactly did you want, And that's when it all started to make sense to me, and I had to take accountability for that. Like, man, I want to actually affect change, and I can't be afraid of that. So no fear, at least in behavior. I can feel it.
Right.
But my behavior better not follow it,
Right.
So that's why I say respect your feelings. Don't give them power.
Excellent. They say it's okay to have fear, and it's, it is something when we don't know what we're going to face, a new environment. Fear is okay, and it's is okay. Understandable, and it's normal. It's there to protect you, but don't give in to it. Keep doing what you're planning to do, no matter how afraid you are. Do it anyway. Don't give in to it. Don't give it power.
The fear would have said, you know what? You don't need that. Or apply next year, or something like that. Fear would have talked me out, So yes, respecting it is to recognize, where's that fear coming from? So that's when I say I recognize, okay, I'm scared of success. I'm scared of being the face. I'm scared of putting my information out there. Somebody will hack it up, like my first book about to come out, and, people, this is garbage, or whatever, That's going to drive me to just focus and get better, of course, better networking, better mentors, all of that good stuff, which is what I'm doing. But still, it's just, not giving it power.
Good stuff. Dr. Lay, what does your social work doctor want you to know?
Now I'm in the military, and you would not believe how many service members that come into my office after we can be in session 1, session 2, or introductions, and they would be like, you're a social worker? And so one of the things I would want people to know is, yes, social workers, we do therapy as well. you know. And even though we operate differently from psychologists, it is simple to understand why psychologists treat severe and complex mental illnesses than social workers, given the availability of specializations like clinical neuropsychologists, right? A psychologist, they are superior and alternative in managing problems that are more deeply ingrained in individual mental processes because of their capacity to truly delve into the human brain, right? But when it comes to social workers, we provide superior answers basically when the underlying causes of mental health problems are tied to persons' personal situations or more significant societal problems. So give you an example. You remember the DSM-4, I want to say, where we had the 5 axes?
Yes.
Right? So you had axis 1, which is your mental health disorder. You had axis 2, which is your personality. But then you had axis 3, right? Which is your psychosocial stressors. And when I think of social work, I think social work, and this is why I applied my practice when I first got into mental health, is I did focus on axis 3 more than axis 1. I had this belief that by focusing on axis 3.
Can you tell our audience, our listeners, what axis 1 is?
That's your mental disorders, right? That's your depression, your anxiety, your bipolar, right? And then your personality is your borderline personality, antisocial
And that's
personality.
axis.
That's axis 2. And then axis 3 was your psychosocial stressors, okay? And those are, like, for instance, where a psychologist will take a homeless person and delve into how he can help them fix his problems or their problem, right? Social workers will dive in and look at, what are the psychosocial stressors? The psychosocial stressor may be he needs home. He needs a home, Let me get that situated before I start tackling the sadness, basically. Right. So with social work, the problems are tied to a person's, like I said, their personal situations or more significant societal problems. So we find accommodations in, like the example I gave with the homeless individual, for instance, it might be the best way to address their sadness is to get them a home. Okay. Or placing somebody in a treatment program together with talk therapy, if you will. Right. So social workers have the tendency and they have the toolbox to look at things from a ecological perspective. We will look at the macro, the meso, and the micro. And we try to fix or try to help this individual resolve whatever stresses or situations they're dealing with, whether it be depression, anxiety, any of those kind of situations. But we do it from an ecological perspective. And I think that's the biggest difference there. And so most people tend to think social workers are just your child protective services, right? Adult protective services and things of that nature. But we are in a field of individual therapy. Right. And we do it very well. In fact, the majority of mental health therapists in America are social workers. Right. So
that's a good point in terms of absolute numbers. You're right.
And so that's one. Right. And I've reached out to some of my colleagues. I was like, hey, I'm going on. I want to hear from you. What do you think? One of the things that came back was, letting them know that all therapies are not equal. Right. So I would tell people if they ever consider getting into therapy, to be sure that they look at evidence-based approaches. And this is very important, right? Because, those that have been repeatedly shown by scientific research to improve client results. So you got to be mindful that we are not discussing any evidence rather than this evidence must demonstrate a sizable level of statistical efficiency. Has it actually been demonstrated to work? Right. Also consider whether the study is valid, and so you should ask your therapist whatever type of evidence-based interventions they plan to use to help with your issues. Does it work? Is it effective? Has it been proven to work? And the reason why that's important, because that kind of moves me to number 3, in that therapy should be time-based. A person wants the best services they possibly can have, right? So when they go into to see a therapist, evidently they're going in because they need help to resolve something that is going on in their life. And it may be pressing, it may be chronic, or it may be acute. So they want the help. It's going to be important that we don't just stick to like talk therapy. They just come in and they just talk. And there's no intervention applied, if you will. And so by session 3-ish, 4, if you will, there's when you start looking at, hey, this is the direction I'm thinking we should head. And when that happens, your therapy sessions become more focused. So people should be mindful of that they're going to come in for an hour or an hour and a half, depending, therapy is different. You come in for an hour, we're going to start with this. We're going to go through this type of evidence base. Okay, so we're going to go through this type of homework, this type of plan, and follow through with it and trust that process so that they can get the help that they need and they can get out of therapy in a good time, I guess you would say, because there's been years, I guess, of clinical research that have yielded one undeniable finding, right? And that was that those who profit from therapy typically do so sooner rather than later. In fact, research suggests that early positive response within, I would say, the first 4 to 6 weeks of therapy is one of the best predictors that whether or not someone will progress over the course of their mental health treatment, right? So you'll hear about some individuals been in therapy for 2 years, 3 years, 4 years. And to some degree, that can be the case, and in these situations, resolving a problem may be as simple as talking about the problems or, looking at their losses, receiving compassionate understanding and wise insight, or receiving trauma treatment such as E.M.D.R. And that's eye movement desensitization and reprocessing. So that's good for trauma treatment. And I don't specialize in that, but I know that's one I will make a referral to someone who practice E.M.D.R. And the reason I bring that up is because that can last years. Okay. That can be 6 months, weekly sessions, depending on how deep they want to go in that therapy. But what the research shows is, hey, if you can get in there, get that work in from the beginning, and learn the tools that you need, and then apply those tools when you're done with therapy, you'll have the chances of you resolving those issues that you are seeking to resolve are much greater. Okay. Not all the time, but again, more times than not, at least that's what the research shows. And so I thought that was really, really important to share with individuals. And now this is interesting here because I want to make sure I wrote that. Yeah. So one of the guys told me, and I'm filling these things in, okay? So they gave me the buzzwords to it, and I'm like, okay, I know exactly what they're talking about. But one of them wants for people to be ready to feel worse before they feel better.
Yes. Okay? Thank you.
That is huge.
Thank you for bringing that up.
Yeah, that is huge.
For pointing that out. That's a big deal.
It is, isn't it? And when he told me
that's when folks want to quit. They're like, well, this doesn't work.
Exactly.
This is horrible. Why did I come here? I wasted my money.
Why did I come here? Exactly. So in therapy is about, working through problems. So in order to process them and change, you must dive deep into some challenging, emotions and circumstances. So recognizing that there will be some ups and some downs along the way, but also let the therapist know if your progress is frustrating you, because some people won't speak up, especially culturally. Some people will not speak up. They'll just go along with it. And you could be heading them in the wrong direction as a therapist, right? So when there's too much under there and the rips start to show, so that's when it's too much emotions and those rips start to show sometimes, or sentiments start to bleed out, okay, through chronic or acute worry or irrational outbursts. When you start seeing different signs like that happen in therapy, I think there is when we as a therapist will sit and say, hey, you know what, we may have to go a different direction. Let's try this approach, let's go this route, right? Because we see them, I'm seeing them at the end of sessions. I would ask my patients, hey, how did you feel about today? And I have literally 7 minutes left in that session or something like that. And it's like, I emotionally, I feel drained, and I'm like, okay, all right. And then I will tell them this is quite normal, to really feel defeated before you start getting that motivation and that confidence to keep going, that you're knocking down these different barriers. Right. So if we start to see that they experience persistent sadness as well as internal, what I would classify as deadness, so more depression than anything, or they become addicted to something. We definitely need to speak up from there. And so
when you say that you need more substance use disorder behavior, did I hear that correctly? Also, sadness.
Or they become addicted to something. Yes.
Addicted to right. So substance use disorder, addicted to something.
Yeah. And that's what they do to mask the negative emotions,
right? To self-treat.
Oh yeah. Right. And they completely collapse, and you end up losing that patient. And then the thing about it is that patient or that client is emotionally scarred. They're like, oh, therapy's not for me, or I didn't get nothing out of it, and that kind of moves into this quick fix mentality. and
Thank you for pointing that out also, Dr. Lay.
I know that you're an MD, so I'm gonna be careful. But I love my psychiatrists because I understand when individuals are in acute stress or they're in a crisis situation. I've seen with my own eyes the importance of psychotropic medication. But I hear also from psychiatrists that, you should be getting therapy in conjunction with.
Always with medication.
Yes, because they're gonna wing you. They're gonna wing you off that medication, or they should, right? Most of the time.
You can't depend on the medication to do the work.
You really can't. Nah, medications are effective against depression, anxiety, and similar conditions, but studies show that they work best in combination with therapy.
Exactly.
And sometimes therapy alone proves superior, and I've seen that as well.
Yes.
I've done it.
Yes.
And so medication can be seen as a band-aid, that's helpful while you're getting psychotherapy to get to the root, of the problem. So that was one of the bullets that somebody sent in to me, was just like, think long-term game, think marathon, think, what am I going to be like 15 years from now? What kind of skills will I be applying? I think that's another important tool. And then the other bullet that someone mentioned, and I think this speaks to the education is not education, where you apply the good you learn. And what came to mind when I saw that bullet come through was, in my experience, education is not education if you don't apply what it is you learn. And we go through school, so much schooling, and we learn a lot, right? But most people would say that the best education in this world is experience, which means you got to actually apply what it is you learned. If you never applied, that means you never had the experiences. You cannot say that you're educated in that, And so when a person comes to therapy, and this is something I really want people to get, is that when you come into therapy and you sit down in a therapy session, think about why it is you react or respond versus what's happening, if you will, to you, okay? And the reason being is because those skills that you're going to learn in therapy are going to be about your response or your reaction to things. They're going to be barriers or protectors of that. Not so much because we know you're not going to be able to stop everything that happens to you, quote unquote, but how you respond is going to determine the next move. Applying the good you learn just means come in, do the work. This homework assignments, if you're using an evidence-based, like our gold standard is CBT, which is cognitive behavioral therapy, right? If you're applying that and it's some homework assignments and we're teaching you relaxation or something like that, or we're teaching you diaphragmatic breathing, and we say, hey, I want you to use that every day. Make it a part of your lifestyle, not just when you start to have heart palpitations, but make it a part of your lifestyle. Like, this is an everyday thing to use. You have now incorporated this in your life. If you do not apply any of those things and you're like, man, you know what, that's good stuff. Meaning you can go and teach somebody else. You can tell somebody else like, oh, you got to apply diaphragmatic breathing. Yes, you go in your nose, out your mouth. But if you have no experience in it and you don't use it, okay, that in of itself, you cannot say you're educated in that. You cannot say your experiences have changed and that therapy has been great for you and all of these kind of things. You cannot say that. But that also leads to this other last bullet that I have, which was your therapist should not be working harder than you. Okay.
I love that.
There is some back and forth. There are some therapists who say, yeah, you should be working hard. And I never said don't work hard for therapists. However, when
you're talking to the clients, the patients, you're talking to the public, your therapist should not be working harder than you. You've got to do the work. You've got to put the work in.
And it's the same as I compare it to that individual. Two examples of that. If an individual was like, man, I have to lose weight, and they go and they literally pay for a trainer, that trainer should not be working harder than them at the gym. If you're going, you're a student driver and first time driving, and you got your, I don't know if they had this everywhere, but when you have a driver that has the steering wheel on the other side, the driving teacher, they definitely should not be steering that car. They're there for emergency situations, but you should definitely be doing the work there. And the reason why that's so important, because we want to avoid burnout. We want to avoid, this is not going anywhere. Not that the patient will get lazy, but you do start to look at therapy as a place to kind of just go. It becomes a routine thing, like a friendship thing, if you will. And you get motivation off of the therapist's excitement. but you're not doing no work behind it. That's the therapy. If the therapist feels totally exhausted by the time they're done with that session, it's working way too hard. We as therapists, we're so passionate, because we want to help so bad, but it's so important for us to see the work of that individual. Coming in, I understand this is what's happening to me. This is how I'm responding to these type of situations. What do I need to do to get myself in a position of accountability? How do I need to apply whatever it is I need to apply every day? That should be the mindset coming into therapy, because you're paying for that service. In conjunction with the friend-on-friend thing, if your therapist is literally communicating with you like your best friend is communicating with you, I would strongly encourage finding another therapist or speaking up in therapy and saying, hey, I can really get this with my best friend or the barber or whatever have you. I'm really wanting some real tools to apply to my life. So those were the bullets I had that I thought was, interesting that came back. The biggest thing I wanted to focus on was the evidence base and understanding how important for individuals, civilians, locals that just, civilians, I'm thinking military, anybody that's considering therapy, going in and understanding, when that therapist tells you, I think we should go in this direction, and they tell you some type of evidence-based treatment they want to use or whatever, you ask the questions, does it work? Has it been proven to be effective? Do your own research with that, because this is your money. This is your time spent,
This is your life. What does the data show? What do the statistics show? What does the literature show?
Have to.
You know what, Dr. Lay, this is outstanding. This is incredible
Thank you.
stuff. Thank you so very much. Where can folks find you? Where can we find you?
Yes. So my website is www.raheemrlay.com or menintervention.com. And of course, with LinkedIn, I'm on LinkedIn as well as Raheem Lay.
So LinkedIn is linkedin.com/Raheem Lay.
Yes.
All right. Thank you. I can't thank you enough. And I know that you have a patient or client waiting, and
Yes.
I'm going to let you go. And again, thank you for all you do and your service. And please, can you come back after your book is released in October so we can talk more?
I'm super excited.
I'm excited for you. We're excited. Have an awesome one, Dr. Lay. Thank you again so much. You take good care.
All right now. Bye-bye.
Ciao.